Ladies and gentlemen, we are coming to the very final part of this particular session, and this is going to be a panel discussion on the topic of biosafety and biosecurity. So we are going to have 3 panelists, and one of them is Special Agent Josh Canter, who just gave us the very last speech. We are going to as well have the second panelist, and this is going to be none other than Dr. Talkmore Maruta. He is from Africa CDC. So to give a brief about Dr. Talkmore Maruta, sorry about that. Sorry, to give a brief about Dr. Talkmore Maruta, he is the Senior Biosafety and Biosecurity Officer with Africa Centers for Disease Control and Prevention, which is Africa CDC. He's a public health medical laboratory scientist with a bachelor's degree in medical laboratory sciences, master's in public health, master's in business administration, and PhD in public health, and currently studying for a master's in international affairs and diplomacy. He has regional and international experience in laboratory system strengthening, disease surveillance and epidemic preparedness and response. He contributed significantly to the development and implementation of 2 flagship programs of strengthening laboratory management towards accreditation, that's LAMTA, and the WHO AFROS strengthening laboratory quality management towards accreditation, SLIPTA programs that have been implemented in over 1,300 laboratories in 55 countries in Africa, Asia, Latin America, the Caribbean, the Oceania, and helped over 200 laboratories attain accreditation to international standards. His experience spans the Africa, Caribbean, and Southeast Asia regions, where he has closely worked with over 30 ministries of health, while working with renowned organizations like Clinton Health Access Initiative, Foundation for Innovative New Diagnostics, Africa Society for Laboratory Medicine, SLM, and the East Central and South Africa Health Community. His work in the region was recognized at the SLM 2012 conference with a Distinguished Leadership Award and the Best Employee Award in the World Bank-supported Southern Africa TB Health System Strengthening Project in 2019. At Africa Centers for Disease Control, Dr. Maruta coordinates the Biosecurity Initiative, whose goal is to strengthen the biosecurity and biosafety systems of African Union member states to comply with international regulations, including the International Health Regulations of 2005, Biological Weapons Convention, and United Nations Security Council Resolution 1540, and the GHSA Action Packages, APP3. Please, let's put our hands together to welcome Dr. Talkmore Maruta. The other panelists, we are going to have Edith Valles, and Edith Valles is the UN Security Council Resolution 1540 expert and is going to be joining us online. Please, let's welcome Edith Valles. My name once again is Sandra Matinyi. And to the dear panelists, in the area of biosafety and biosecurity, the first question that I would like to pose is, in dealing with a pandemic, what has been your biggest challenge as biosafety and biosecurity experts? And with that, I would like to start with Dr. Talkmore Maruta from the Africa CDC.
Thank you very much, Madam Chair. And it is an extreme honor for us to participate in this meeting. So very briefly and quickly, there are two major challenges that I would like to highlight, Madam Chair, that we indeed faced during this pandemic when it comes to biosafety and biosecurity. One of these is the lack of or inadequate legislation that specifically speaks to or addresses the issue of biosafety and biosecurity. In some instances, this slowed us in the response, and as you may know, in some member states, this resulted in some litigation measures being raised against the governments. So the lack of or inadequate legislative frameworks that specifically speaks to and addresses the issue of biosafety and biosecurity. As the Africa CDC, we have taken this head-on, and I'm happy to let you know that at the moment, together with member states, we are working in developing a regional biosafety and biosecurity legislative framework, which at the moment is, we have done consultations with member states, and actually in 3 weeks' time, it is going to be discussed by our ministers of health at the Africa Union, at their specialized technical committee for health and social affairs the first week of November. So for us, this is a very critical and important document to pave way for implementation of biosafety and biosecurity at national level, because lack of proper legislation hampers enforcement of requirements for biosafety and biosecurity. Secondly is the issue of infrastructure. So you would agree with me, Chair, that for most member states, the existence of appropriate infrastructure that complies to requirements for biosafety and biosecurity is lacking in most countries. However, we are happy to hear some innovations that are being discussed here, that we are moving towards cleaner technologies. This will really help in ensuring that some of these procedures and processes we would like to implement can be done safely and securely. I recall during the early days of the pandemic, many of the laboratory staff refused to handle specimens for suspects for COVID-19, simply because they lacked proper equipment. There was no proper infrastructure to ensure that some of these processes and procedures can be processed or conducted in safe and secure environments. As Africa CDC, we have also taken this challenge head-on. Besides supporting member states with resources to improve their infrastructure requirements. We are also putting together a regulatory and certification framework for institutions that handle high-risk pathogens. This regulatory framework will allow member states or empower member states to enforce some of the biosafety and biosecurity requirements for some of these institutions that are handling high-risk pathogens. It will also come with a set of minimum standards that these institutions need to comply to, and also a framework for sort of giving member states some ability to evaluate whether these institutions are meeting these requirements and then enforce measures where non-compliance is observed. Thank you, Chair.
Maruta. Thank you so much, Dr. Maruta, for that response. And I would like to move on to Dr. Valles to get her view on the same question.
Okay, can you hear me now?
Okay, we can hear you now. Please.
Okay, yeah, well, I mean, I don't know what happened because my microphone was on. But okay, well, thank you. Thank you, Madam Chair, for your question. And thank you for letting me participate in this debate, as well as because in the morning I delivered a presentation about Resolution 1540 and how it's implemented in the region. During my presentation, I said that we analyze a series of measures that the 1540 Committee considers for the full implementation of Resolution 1540 in terms of accountability, security, and physical protection of biological weapons, including biological-related materials. And only 5% of those measures are implemented in Africa. This means that there are serious gaps in the implementation of biosecurity measures. And as you know, if there are serious gaps in biosecurity measures implementation, there is also an increased risk of stealing those biological related materials and possibly misuse them. So I'm so glad when I heard what Dr. Maruta said about all those initiatives that the CDC Africa is having, because that will increase in a very exponential way the way that these measures are implemented in Africa. And of course, from the 1540 Committee, we can help all the African states and also the African Union and CDC Africa to work together for the sake of the implementation of the biosecurity measures in Africa. In terms of how the pandemic affected the implementation of those measures, I mean, what Dr. Maruta said was totally graphic and explicit, and I can't add more to those words. Thank you.
Thank you so much, Edith. I would like to pass on the microphone to Special Agent Josh.
Yeah, I want to first echo what the last two have said, but also with our program, because our program is so heavily outreach-based, one of the biggest effects that the pandemic had was the lack of ability to do that in the traditional fashion, which would be one-on-one, face-to-face. So we had to become creative, and thankfully between Zoom and Microsoft Teams and Skype and everything else, we were able to continue to do our trainings and our outreach on a large scale through electronic means. But there were some things that we had to continue to do on a face-to-face basis, and that's especially when it comes to responses and when issues would come up, we still had to go out and interface with the public, so we had to figure out a way to do that in the safest way possible, using protective equipment as necessary, masks and gloves and things like that. But yeah, overall, I mean, I think we all kind of shared the same issues when it came to the pandemic, and our responses were varied, but it was a matter of scrambling to find either the technological or physical means to overcome those issues.
Okay, Thank you so much for that response. We shall move on. The next question is, how can synthetic biologists aid government in ensuring biosafety and biosecurity? And I would like to start with Edith. Edith, over to you.
Okay, now I'm okay. I mean, for us, it's a little bit tricky, that question, I mean, from the 1540 point of view, because, I mean, even though there is a follow-up resolution considering the 1540, that it was the first one, and a follow-up that it was the 2325 from 2016, which expresses that states should take into account what's going on about those new technologies, because those technologies could be used, could be misused. I can't say anything else apart from that, because I mean the mandate of the resolution is that ends in that sense. But I can say that these technologies can be misused, and all the biosecurity measures that need to be considered in any field of biology, of course, includes synthetic biology, because there is the need. I mean, we've heard so many advices, for example, in previous presentations about what researchers should do in order not for those, for example, results that comes from synthetic biology could be misused as well. So that is from the 1540 perspective. Thank you.
Thank you so much. Special Agent Josh, what do you have to say about the same?
Well, not to be overly glib, but I think the secret for us has always been that interpersonal communication. The thing that was best for us was going directly to those researchers, to those labs, and really becoming a partner to them. Whether that is doing as I've done on times and just sit in on lab hours and talk to the researchers, or to go to their presentations, or to go when they have big conferences and forums, just like Synbio Africa, and to be in the room. I think that's the biggest thing that we can do in terms of partnership, is just to always be in the room, to be a friendly face, to be somebody that when there is an issue, when there is a problem, when they have a question, they're not calling the FBI as a monolithic institution. They're calling Josh, who they know because they got a cup of coffee with them, who sat at the bench top with them, who's discussed science, who's discussed their families, discussed what's going on in their lives. And it allows the sort of open level of communication. And I don't think that is something that is unique to the FBI. I think anybody has the ability to do that. It's just finding the time and the inclination to go out and be that partner to the community.
Okay, thank you so much for that. We are really, really so delighted to hear that. And we surely will reach out. Yes, Dr. Maruta.
Thank you very much, Chair, and thanks, Edith, and thanks, Josh, for those insights. Certainly, it's a pleasure to share the same stage with you. I normally would just be hearing of agents in FBA on television, but I'm glad that I'm sharing a stage with the special agent Canter, and thank you. So I'll speak to two things that we would like to request to our synthetic biologists. One is that we need to come up with cleaner technology. We know I've spoken about the challenge of legislation, I've spoken about the challenge of infrastructure. As long as these exist, and we don't have cleaner technologies that can be used, we'll still continue to face similar challenges of access like we are having now. Cleaner technologies certainly have helped us to be able to have real-time response and real-time decision making. I'm a laboratory scientist by profession. 10 years ago, I would not have dreamed of a day when we can do genomic sequencing on a benchtop. It's unimaginable. But this technology, which is cleaner, has allowed most member states now in Africa to be able to do genomic sequence for COVID-19. This, without such cleaner technologies, having to wait for the proper infrastructure, having to wait for the proper legislative framework, would have taken us another 3 years to reach where we are. So my appeal is to the synthetic biologists, please continue to work and be innovative to give us cleaner technologies. I would speak to the second issue of advocacy and communication. It is one thing to have the best idea. It is one thing to have the best technology. It is another thing to communicate this best idea, this best technology to the person who is making the decision. Unfortunately, at the end of the day, the person who decides whether this should be used or whether this should be purchased is a person who has no idea on science. One of the mistakes that we make as scientists is that we communicate to everyone using the same wavelength as if we are communicating to fellow scientists. At the end of the day, if I am a policymaker, I'm sitting in parliament and I'm debating on something, and I'm looking at all these figures and numbers that you are putting, these strands of DNA, you're talking of messenger RNAs, I will just shut down, and then I'll only wake up and say, we'll have to look at this further. Because I'm giving myself time to be able to try and understand what you're talking about. So what I've observed in most of innovations, in most of these policies, these frameworks that we come up with, we do not bring that alongside that communication and advocacy and communication strategy. At Africa CDC, we have learned this lesson. And when I spoke about the legislative framework, alongside that legislative framework, we are actually developing, or we have developed an advocacy and communication strategy to say, we will have this document, but this document will have to be implemented by member states. And it has to be implemented by stakeholders, including civil society. We have no understanding of biosafety and biosecurity. How do we communicate to them in order that they can be able to understand and support us? So that's my second appeal to all biologists and scientists, that as you come up with your innovation, as you come up with your ideas, please ensure also that you are able to communicate this effectively, especially to those policymakers and decision makers. Thank you, Chair.
Thank you so much for such great insights. You talk about things we've always heard, and sometimes we go back and we are wondering, the legislators are not really being supportive and all that, but so many times it's always coming from how we are communicating. So thank you so much for bringing this up again. We talked about it earlier, but you bring it out very clearly, and what this could mean for the kind of work that we want to do. I'll move on to the very last question, and this one, I would like to start with Special Agent Josh. What do you think tends to be missed out in the conversations about biosafety and biosecurity? Hello, Josh.
Hi, sorry, I was just waiting for the ability to I think the biggest thing that gets missed out is safety and biosecurity starts in the lab, and it starts in discussion between the investigators and the researchers and the institutions. We can talk all day from a legal, security, regulatory standpoint, but until that message permeates the labs, there's just matters. Ask one more question. And by that, I just mean that you ask one more question from an ethics standpoint. If you're not comfortable with the ethics of the research you're doing, ask one more question to try to figure out what it is that's making you uncomfortable. If you, from a security standpoint, if you're not comfortable with what you're being asked to do, what is being asked of you, or what somebody else is doing, ask one more question to try to determine where that level of discomfort comes from. If you are not comfortable with the regulations or with what folks like myself are telling you, ask one more question until you get comfortable. And if you're not comfortable, ask another question after that. Get yourself in a position where, as the subject matter expert, you're the best possible forum for the answer that you're looking for. And if you can't find it, you find somebody who can answer that question for you.
Thank you so much for that. We really, really appreciate that response. Edith, over to you. What do you have to say about this?
Great. Thank you, Madam Chair. Regarding biosecurity, I can tell you what is my experience wearing my previous hat when I used to do outreach to the professionals and academics and in the biosecurity field. I remember that in those times, many of the people who are approached didn't have an idea about what biosecurity was. And the very first thing that I told them, if they were dealing with highly pathogenic bacteria, for example, or viruses, and they told you, guys, you have to be careful with what you are dealing with, because if this is misused, it can be a weapon. And they said, no, this is not a weapon. This is the Escherichia coli that I'm working with, and it doesn't harm anybody. So that is why outreach is so important, and reaching the right people, because we can have two types, as we know, we can have two types of approaches, the top-down and the bottom-up. The bottom-up is great because you reach out all those people who are handling those materials. But if you don't have the top-down approach with a legal framework that acts like an umbrella for everything, it won't work. So that's why I think that it's really very important to have both approaches, and in order not to mistell anything, we have to be careful about the message that we are delivering. Thank you.
Thank you so much, Edith, for those insights. I'll right away move to Dr. Maruta to give his view on this particular question.
Thank you very much, Madam Chair, and my fellow colleagues. So I'll speak to maybe two main issues, which I think are really missed or not dealt with adequately when it comes to biosafety and biosecurity. One key and foundational principle with biosafety and biosecurity is that it cuts across many disciplines. If we were to do a survey in this room, you'll be amazed or surprised, or I will not be surprised, that the people that are in this room are skewed towards a certain discipline or a certain specialty. We miss out the other disciplines that are key when it comes to biosafety and biosecurity. It includes agriculture, it includes human health, animal health, security personnel, the army, state security, immigration, customs, civil society, church leaders. These are all disciplines or stakeholders to biosafety and biosecurity. You would then see that in most discussions or platforms where we are discussing the issue of biosafety and biosecurity, it doesn't represent this key principle of biosafety and biosecurity, that it cuts across many disciplines. At Africa CDC, Mr. Atek, who was, we had a presentation in this session, chairs one of our regional technical working groups for biosafety and biosecurity. And we did not want to make this mistake in this technical working group. This technical working group is a multi-sectorial, multi-expert, and it consists of people from human health, animal health, agriculture, environmental health, biotechnology, institutions of higher learning, our universities, people from state security. We have church ministers, we have parliamentarians. This is how biosafety and biosecurity should be represented when we have discussion. The second thing that really makes me not to go to sleep most of the days is that why can't we have biosafety and biosecurity as a profession? We do have people that specialize. We have microbiologists that are here. We have epidemiologists. We have gynecologists. Why not people specialize in biosafety and biosecurity? So this is one thing that in our discussions, I think I've seen that it is missed. You find that we talk of workshops. So you have a 5-day workshop on biosafety and biosecurity. You have a 3-day workshop on biorisk management. But all these are not programs that turn biosafety and biosecurity into a professional program. And to make matters worse, we don't have these in Africa. As I was listening to some of the introductions in this meeting, we have people that are professionally registered in XXX. This XX is not nowhere here in Africa. These are XX institutions that are elsewhere. Do they address our real concerns? Here we don't have the necessary infrastructure. We don't have the necessary legal expertise. We don't have the necessary legal instruments. Do these structures that we have elsewhere able to address our needs here in Africa? I don't think so. This is why we need to ensure that we have locally developed, locally driven, and interventions that answer our own problems here in Africa. And as Africa CDC, just last week we were in Nairobi, Kenya, where we were finalizing or reviewing a regional training and certification program for biosafety and biosecurity experts. And we are initially looking at 4 areas of specialty. First, on biorisk management. Second, on clinical waste management. Third, on management of high containment facilities. And fourth, on specialty for certification, installation, and maintenance of biological safety cabinets. And we are developing a homegrown training and certification program that will be endorsed by our AU heads of states, that will be endorsed by our AU member states, that will be accepted across the 55 AU members, such that when I move from this place to go and certify a biological safety cabinet in Angola, I will be able to do that and accept it. For me, these are key. Biosafety and biosecurity should be considered and approached as a professional program. Thank you, Chair.
Thank you so much for the insights. We really appreciate you bring to our attention some very key issues that we truly need to deal with. And such discussions really need to go on, and then we see how we can move to implementation of those different strategies. I would like to now open the panel to the rest of the team. If you have any question, the people joining us online, feel free. If you have any question, you could put it in the chat, and then we'll have it answered. And for the members here, just put up your hand, and the microphone will find you wherever you are, and you ask your question. Okay.
Good evening, everyone. I am Albert Kure from Nigeria. So my question is around practical steps that we need to build synergies between all of the stakeholders. So I know most times we talk about collaboration and partnerships and all of that, but in certain spaces, it's easier said than done. So I work as West African Partnership Lead for Thought for Food Foundation, and I see this thing happening daily around how so much work gets put into trying to establish networks and build partnerships, but all of that falls to naught because the people who are stakeholders are supposed to partner with one another do not get the importance of those partnerships. So I would want to ask the doctor seated here or any other person on the panel, what key steps can we take in terms of A, B, and C to build more synergies between all of the stakeholders involved in the biosecurity and biosafety conversation? Thank you.
Okay, thank you so much for that question. We are going to be taking the questions, and after that we'll have responses to them. So if you have another question, please just put up your hand and we take it. Ivy, there is one. The people joining us online, please feel free to ask your the questions. Just put your question in the chat, and we'll have it responded to.
Okay, my question is directed to Dr. Maruta, and it concerns the issue of biosafety in health and also under the Cartagena Protocol. Because I remember that when the issues of biosafety and biosecurity came in, we had a lot of challenges from our country because we realized that health is not under the Cartagena Protocol. And therefore, our experts in health wanted to understand their biosafety in their own world, where now we are establishing the National Biosafety Authority, and some of those misunderstandings are yet to be resolved, even within the countries that have the biosafety legal framework for GM technology. Because those experts are not able to work as one team. The other issue is when you come to the issue of biosecurity, you also find that even internationally, they are under a different convention, because biosecurity is under BTWC and also Resolution 1540, where biosafety for GM is under Cartagena Protocol in the CBD. And we also understand that biosafety has been a practice for healthy experts for many years, and therefore they have their own guidelines. So we really would want to have a conversation where all these teams can come together, so that even if we want to have a training program, that the understanding of all these issues are understood as one. Thank you.
Thank you so much. I will be taking the last question from here. Yes, Harry.
Yeah, thank you
and
very
then
much.
We'll have the responses.
Thank you very much. My name is Harry Akligo, and I'm a fellow from Ghana. I wanted to ask one of the panelists, I think it's directed to the one next to you. Sorry, I forgot the name. But then you mentioned that it would be good to see programs that certify, or so to say, make people become experts in biosecurity and so on and so forth. But I wanted to ask, do you think that, I mean, if you're a scientist, you'd want somebody to rather come and oversee a work which you may potentially consider maybe dangerous or something like that? Don't you think that those groups of people rather should have those levels of training rather than having to certify or train somebody to be an expert in that field before we can have those conversations around biosecurity and biosafety? So that's what I just wanted to ask.
Okay, thank you so much, Harry. I just have one question that has come in through the chat, and let me read that. It's specifically going to Edith, and then we'll have the responses. So the question is, how can young researchers interested in aiding the top-down approach that you were talking about get involved? Edith, did you get that? We could start with you.
Yeah, can you repeat that please for me?
How can young researchers interested in aiding the top-down approach you were talking about get involved?
Okay, that is a good question. Yeah, I mean, sometimes it's difficult to get to the ones who are in charge of the policies, the policy makers, and that's why, in certain way, sometimes there is our role from the international institutions to reach those policy makers to raise awareness about these issues, but sometimes it's not that easy. So, I mean, I remember myself, because I had the same problem in my country, to raise awareness about biosecurity, and I tried hard. I tried every time that I had the opportunity to reach out someone that has a senior position or someone who would be involved in drafting laws, for example, I reach out everybody that I could in order to explain to these people the importance of the implementation of biosecurity and biosafety measures. But I mean, I can give you my email and we can chat about this and I can give you all the ideas that come to my mind. But also you can reach out international organizations that can help, I mean, for example, to reach out the region and to raise awareness about these issues. But my email is available for anyone who would like to talk to me about these topics. Thank you.
Okay, thank you so much. I believe the person who asked the question has taken note. She'll probably reach out to you and she'll get that. I would like to now pass on to Dr. Maruta to answer the questions that were asked.
Thank you, Chair, and thank you to our participants for those questions. So very quickly to my brother from Nigeria, the land of Ogusi soup. I enjoy it when I go there. So very quickly, I think one of the things that we need to do as organizations and institutions and individuals is to sort of increase awareness of what is it that we are doing. As I was sitting here since morning, I got to know a lot of things that many of our scientists are doing in the many places where they are. And this is sort of the first way which we can then be able to set platforms for engagement and collaboration. So unfortunately, sometimes as scientists, we tend to build hedges around the work that we are doing for fear that someone may take this, run away with it, and make money out of it. But that also then hampers the platform or the opportunity for creating some of the synergies that are needed. To my brother from Kenya, also the land of Nyamachoma, it is unfortunate the issue of the Katagona protocol, which did not include human health. But I would like to speak to your questions just broadly and maybe in a blanket. One of the issues we identified during some consultations we're doing with member states in the last 3 years is that when it comes to biosafety and biosecurity, especially policies, there is a lot of disintegration. You'd find that biotechnology has got their own policies to GMO. When you go to agriculture, they have theirs. People in health, they have theirs, like you have indicated. But then we do not have in the country a central point where all these requirements for biosafety and biosecurity are actually coordinated from. I'm happy that you are talking about establishing an agency in Kenya. In the legal framework that we are currently developing, Chair, the very first domain or article in this legal framework is to ask member states that they need to establish an authorization or a lead entity that is given the responsibility to coordinate and regulate biosafety and biosecurity in the country. So then this becomes the central point in which agriculture, people from security, people from biotechnology have a central point from which biosafety and biosecurity is coordinated. All these issues of compliance we're talking about and so forth. It then helps to solve this issue of disaggregation when it comes to biosafety and biosecurity. From Ghana, I hope you brought us some chocolates, from Swiss chocolates from Ghana. But the issue of training, you know, as I listen to you as a young scientist, I feel a heavy heart in that here is a scientist whom we have made, us elders and pioneers, have made to believe that if you are trained and certified elsewhere, you are bound to do a better job than someone who is trained here in Ghana. It is our fault as the pioneers and the leaders in these programs, because this is the sort of environment we have created. This is sort of the perception that we have created. But we have to work hard to correct this perception, because I don't think a person who is an expert for maintenance of biological safety cabinets here in Uganda, for example, is not as good as someone who is an expert in maintenance of biological safety cabinets from elsewhere. And this is something that we as I've said, we take the blame and the bullet for creating such a sort of environment and the perception to our young biologists. But like I've said, we are working very hard with this regional training and certification program that we are developing, which is homegrown, and will meet all the international and regional requirements, and these people should be recognized to do any work elsewhere. What is important is the AU member states, we should be happy with the program that we develop. If we are happy, then I'm happy to have anyone come to my country trained under this program to certify or do any of their work in biosafety and biosecurity. Thank you, Chair.
Thank you so much. You touch very pertinent issues that the members here raised, and we really appreciate the responses that you've given. With that, I would like to call off this session. I want to really thank so much all the panelists. Thank you so much for the responses that you gave, and the attendees for the questions that you raised. And I would like to now pass on the microphone back.